We will have Pedro from MS Society in Spain, who also prepared video for us to talk about the very exciting projects that was developed to tackle lack of data. Pedro will be with us here today to answer any question you might have.
Hola, bienvenido a todos. Mi nombre es Pedro.
And welcome. My name is Pedro Carrascal. I am the CEO of the Spanish Multiple Sclerosis Society, the Spanish Patients Association. And I will be talking today about EMData. EMData is a multiple sclerosis data lake to show the reality of MS patients from their perspective. And well, I'm going to start now, and I really hope that you find this presentation interesting. This is how we used to present the MS data in Spain, with graphs, infographics, and data estimates. We asked our expert neurologists what prevalence and incidence estimates were available on the disease, and we statically show them. We did not have any other data, so that was all we could show. This was the case until a few months ago. This initiative about sharing and collecting data and creating the MA Data project sprang, like other initiatives in other countries, from the COVID-19 pandemic, and was inspired by the learnings from the MSIF Global Data Sharing Initiative. When we learned that other countries were collecting data, we wanted to get involved too. Spanish patients participated very actively, filling in forms submitted to the global initiative. Yet we noticed that in other countries such as Argentina or Brazil, initiatives or websites were being launched using their own data collection system. So we realized at the time that we were missing an opportunity. The fact that there was no such thing as a patient registry led by doctors in Spain meant that we were missing opportunities to collect other types of data. Data not so scientifically relevant or that doesn't have scientific quality, but highly significant in terms of making MS more visible. This is the subjective perception of patients, how they live, or what they think and whether they have had COVID or not. We felt that the Global Data Sharing Initiative was the perfect way to challenge us and trigger a reaction. So we got the ball rolling. We had already noticed that the Spanish Association Against Cancer had an observatory, a website, showing data and reports, but also noticed some dynamic data. Data on cancer was shown interactively via Microsoft Power BI. And we realized that that data could be accessed differently. The idea stayed in our minds for a while, but it was the connection between this idea and the need to start collecting our own data what made us say, well, let's try to do it with MS2. It really is time to take action. That was when EMData materialized. We found that EMS data was hidden. We did not know it, but perhaps just as the Association Against Cancer had found some public data, we could find it too. We contacted them, talked to the tech providers involved, and started looking for MS data. Surprisingly, this data existed. The data was unknown to us, to our neurologists, even to local politicians. Probably nobody knew about them because no one had ever cared to disaggregate MS data from the rest, either health or patients' data. That is when our project started to take shape. We realized how much there was to exploit, all the data we had never imagined having access to. Making the invisible visible from the patient's perspective means we will know who is living with multiple sclerosis, how they are living with MS, where they have been living, and since when. This information was impossible to know before, but now we are able to look at MS from many perspectives. It will provide us with a far more global vision from the individual, focusing on the MS patient. Not just data for monitoring their disease clinically, for MRIs as it's done in hospitals, but data about their lives, about the way in which they live with MS, the challenges they face, and their unfulfilled needs. But why did we realize it was the right time and it was so important to do it? Well, as mentioned before, we had no official records for MS patients. In some hospitals, some neurologists in Spain kept patient databases. These experts usually worked together, but never compiled all the data, and especially never did it in a global way. So this data was not centralized. The fact that there was no registry was one of the incentives encouraging us to move forward. In Spain, the MS patient community is well organized, it has matured. Patients are willing to participate. Every time we conduct surveys and studies, Spanish people with MS want to collaborate. There is proactivity amongst MS patients, and we felt they would be happy to cooperate anytime we asked. On the other hand, we witnessed the beginning of a new era for data publishing, for example, in public health. We saw that healthcare was changing and the importance of data was being discussed. Although there is not enough data right now, the trend is growing. For instance, there are some public health initiatives to ensure that in the coming years, more data will be made available and it will be shared with the patient. It is an upward trend. And so it was an opportunity to access more and more data. These three factors, the lack of a registry, the proactivity shown by patients and associations, and the trend of having more and more data, encouraged us to launch this initiative. EM data, or this data lake, aims to capture as much data as possible, store them in a cloud, analyze how to exploit them by cross-referencing them with other data, and then display them interactively. This is another key aspect for our project. We will show this data in an interactive way, which means that anyone accessing this data will be able to manage their preferences. They will see how some data affects some people more than others. They could make changes. In short, customize the data. And what is our architecture? Our architecture is cloud-based and uses the Microsoft Azure technology, in which we collect different data sources in other formats, either CVS, Excel, through API, from different public information systems, and physical databases. We gather them through Microsoft Azure's own data lake tools. We analyzed and managed them using our own IT providers in the Azure cloud, and then we displayed them interactively through Microsoft Power BI. One of the first pieces of information we published was the research priorities for patients in Spain. This is closely linked to MSIF's advocacy on the Pathways to Cure initiatives and research priorities. When we decided to endorse it in Spain, we noted that patients in other countries, for example, the UK and Australia, had given their feedback on priorities and surveys had been conducted. At that point, we thought we should do the same in Spain and that EM data should be the focal point in the future, where we could ask patients about their information, host the collection forms, and show them the data. We wanted Spanish patients to get used to the idea of data being gathered and shown by EM Data itself. So far, I was referring to official data captured from official databases, but a part of EM Data is also related to the patient's subjective feedback. There are some examples, such as these, or some other surveys conducted on a regular basis that we will be uploading to EM Data. In this case, we have around 1,600 forms displayed interactively about priorities for MS patients. What is more important for Spanish patients with MS in terms of research? We learned that the research priorities are not the same for someone with a progressive MS or a person with a relapsing, remitting form of MS. And it is not the same if you're a caregiver or someone suffering from MS. We see that priorities change. And this is relevant not only for us, but also for researchers. Even the area within the ministry in charge of research has noted that EM Data offers a new way of understanding research needs and represents a good practice they want to promote. During a meeting, a person within the ministry told us, and I quote, "This is how we want to work to meet the patient's needs. A documented, straightforward way explaining in great detail how much research matters to people." That's how we have created a new way of collecting data. And how is this linked to the Atlas? The MS Atlas is also displayed on this page. One of the tabs shows the reality in other countries through the Atlas. It is embedded on our page because we wanted everyone in Spain to understand that this interest we have in data is related to the global interest of MSIF and the wider MS community in understanding the reality of MS. On the other hand, the aim was to reveal that until now, it had been impossible to provide data from consistent and reliable sources, but now a new era has begun. So EM Data is just the foundation of what the future of MS Atlas could be in Spain, and shows the way in which Spain wants to contribute to the collection of MS data. We felt they should be closely linked from the very beginning. As mentioned, we had contacted the providers of this technology, and they helped us to find the primary care database, which, surprisingly enough, included those who suffered from MS. We would have never imagined that we would find 58,000 people in Spain, and that we would be able to see who were men and women, how old they were, in which communities they lived, and even their evolution over time. How many people there were last year, this year, and now, and updated every year accordingly. Remarkably, we saw that the prevalence, although this is not a prevalence study, and it is not the prevalence of MS, but people treated in primary care in the different autonomous communities, was very close. 123 out of every 100,000 people have multiple sclerosis based on this data, when our estimate was about 120 approximately. So we have updated our figures to 58,000 when we had estimated 55,000. But from now on, this will be our new baseline when looking at increased number of cases. If you access the emdata.es website, you'll be able to filter data by year, sex, age, and autonomous communities, and you will get access to the data in a customized way. What else have we found? Well, for the first time, we have found data on employment and MS. We never thought that such data could exist. Thanks to this data, We have seen who from these 58,000 people is working, who is not, how many worked last year, and the progression. We noticed that the problem is not the unemployment itself, but leaving the job market. The number of people retiring early, that is people of working age leaving the job market, is much higher among people with MS than among the rest of the population. You can see this in the chart on the right, showing pensioners, so people who have already retired, and pensioners with MS. You will notice a difference of 7 points compared to 33 for people retiring early against people retiring early who suffer MS. All these charts, as I said before, are interactive. I've shown you data on feedback and research priorities, subjective data, and data on people with MS. Regarding employment, but we're still digging and working on a lot of data, for example, on comorbidities, anxiety, and depression. This information is also available on our website. We are currently compiling rehabilitation data through service filled in Spain, but stored and not shown except in a PDF report. We have published information on how many associations there are, how many members they have, their addresses, and the services they offer. All this information is also available on EM Data. We are currently working on clinical trial data, treatment data, and along, etc. So we are very happy about it. Yet, we could not do this all by ourselves. We work in partnership with Babel, the technology provider helping us to analyze this information, and with Microsoft, who is collaborating with us and assessing whether to include EM Data as one of the success stories or as an example of how its technology can be applied to beneficial things. We are planning to do a presentation in Spain in September, and we are partnering with Microsoft as they might be helping us to spread the word. To conclude, I am showing you a video showing what the website looked like a few weeks ago. It is constantly changing, so probably by the time you access it, it might have changed already. Notice how by clicking on any of the reports, you get the interactive charts. The figures and the charts start to load. And as you can see here, we can see the updated figure. This was an earlier figure from 2019, and now we have the 2020 data. It is possible to browse by women, men, and autonomous communities. Whether you click on, the data changes entirely. We may select a specific autonomous community by clicking on it. We get the data from that specific region, tells us how many people there are and their age. And this allows us to access raw data without filters, so everyone can use it as they see fit. We are even open to proposals from researchers, patients, and anyone else on how to use the data differently, display it differently, and even to new ways of gathering it. It is an open project, and we look forward to receiving further feedback. Here you can also see the research priorities that were displayed statically with a slide and a screenshot. Here there are 1,600 forms filled in through the EM Data page and displayed dynamically, where we can see if the priorities of MS patients change. For instance, we can disaggregate a particular question, how to treat the disease better. We can see how old patients are or how many years have passed since diagnosis. Let's break it down by years of diagnosis. We see that patients with secondary progressive MS differ significantly on research priorities in some fields, where reversing the damage caused is a higher scoring priority. We can also filter by years since diagnosis and check whether the priorities change. And as you can see here, they are indeed different. So to conclude that all patients share the same research priorities is problematic, since every patient has its own. This is the power of data. I believe this would wrap up the presentation and we can move on to your questions. Thank you.
Another interesting example about how you can use a lack of data, how that can inspire you to use different ways of getting around that. And I think it's really interesting to hear from the Atlas perspective, again, how more accurate your data is. So I want to open the floor now and see if we've got any questions from in our different languages first. So I'm going to go to Paulina first of all, and for the interpreters, Paulina is going to answer, read out any questions she has in Spanish, or at least tell us if she's got any questions. So if we start with Paulina first.
Sí, tenemos varias preguntas.
Yes, we actually have quite a few questions in Spanish. One of them is where the funding was actually sourced from to cover the costs of this project, Pedro. Sorry, I was just changing the question. Was it about funding? Well, yes, in actual fact, it's a really low-cost project, as is always the case. You know, when we start off with this kind of initiative in Spain, we never really have that much funding behind us. And what we do is we end up then putting together quite a small website and getting in touch with tech providers and whatnot. And so everything that we've worked on thus far throughout the year, there's no one actually specifically dedicated to working on that project. It's just the association, people from the association. We use our own time to do so. And throughout this whole year, we've not gone over 10,000 euros. So it's something that really is quite low cost.
Thank you very much, Pedro, for answering that question. I'll now try to go to Duna to check if you've got any questions in Arabic, and Duna will be answering those questions in Arabic, and then we'll wait for that to be translated for Pedro, and then he will answer.
Thank you. There's a question from Nisreen Amir. Do you have any do you launch any campaigns on the ground?
No, es totalmente online.
No, not at all. In fact, the campaign's 100% online. We work on it purely from our office, and we haven't actually had to go on the ground, so to speak. We haven't actually needed to visit hospitals nor actually meet up physically with people. It's a project that's been totally doable without moving from our own office space structure.
Excellent. Well, thank you, Pedro, for answering that question. I'll go over now to Lily to see if there's any questions in the English channel.
Hi, yeah, we did have one question. So one person wanted to know more about where the data was coming from and whether you took any data from doctors, ministries of health, or insurance companies.
Hemos ido encontrando datos.
Yes, we've been finding data that we've classified in 2 categories: official data and data that we've come across by entering into contact with patients themselves or people suffering from MS. And so we've also been working with the Health Ministry and the Spanish National Statistics Association, the INE. And so we've not actually had to do that work ourselves, and we save on costs. Obviously we save on the legal and the costly process of how we actually deal with that information ourselves. We actually get it in specifically broken down bucketed up information, if you like, and we've got that off the back of surveys that we've given out or run beforehand, in answer to your question.
Thank you, Pedro. So I'll go back to Paulina now, because I think there may be another question in Spanish.
Sí, Rachel, hay varias. Primero voy a hacer
Yes, Rachel, there's a few of them. First, I'm going to just make a really small input myself. That's a really small question, so as to see how you actually got into contact with Microsoft. That's what we're being asked here in the chat. And then Andrea Prato is also asking us whether both speakers might be able to offer 2 to 3 suggestions for associations whose countries still don't have a national registry set up off the back of their own learning experiences, on the back of those experiences set out in this webinar.
Nos ha sorprendido tanto a nosotros.
Well, actually, data has really been a surprise for us. You know, our institutions, our doctors even, didn't know that that data was out there, and being getting into contact with Microsoft directly, with the corporation, was a piece of luck, if you like, that we came across on the way. We can even say to a certain extent that they got in touch with us. We came across someone who works at Microsoft who has multiple sclerosis, and so having someone actually in there, so to speak, has made it all incredibly easy. It's just a piece of luck that we'd all been waiting to just fall out of the sky into our arms, and that's the way it's been. It's been great. And what was the last question? Paulina, could you just remind me the other question? It was advice about how to, yeah, I think I lost you. Yeah, it's it's a question made to both yourselves and the Indian speaker. If you can offer 2 to 3 suggestions for those associations whose countries still don't have a national registry in place, on the back of your own experiences and learnings. Yes, basically we've opted for a solution where the national registry seemed so complex, and the only thing we could do was lobby for it and hope that neurologists or the Ministry of Health would do it, because it was too big for us to sort of take on. And so it wasn't going to be in our hands, but we were going to facilitate the data of our patients being available somewhere. And so we were trying to do something where it didn't depend on us. So in the case where there's no registries in place, I would ask, what can you do about the data within your field of expertise and knowledge? You're probably doing some sort of data collection, running some sort of study or report, and all of that could have some value if it were collected and presented in a different way. And so try and break the problem down into bite-sized chunks that can be more effective. So we've seen that the most important thing in all of this is actually getting off the ground, and then you obviously have to work pretty consistently. It's biting off something that's way too big for you to chew, but if you do it in bite-sized chunks, you should be able to get off the ground running.
Thank you, Pedro. I just wanted to invite Sandeep and Javid just to answer that question as well.
The question is whether you would be able to give us some suggestions to those multiple sclerosis associations that don't have national registries set up yet. Where should they start? How should they go about starting to set up a national registry?
I will just like to take this. See, here we are also doing this as a major advocacy project, and it takes time for convincing the government authorities to start any new registry. See, this registry needs to be started. In India, it is ICMR. In the all the places, there will be certain healthcare. Either it will come under Ministry of Health or it will come under Ministry of Statistics or Data. So you need to do advocacy with a particular ministry or bureaucracy for starting this registry, because and it is little long run process, but once it starts, then it will be taking its own momentum. Starting is important, and once government does it by way of sort of a mandatory thing, then all the hospitals will be required to submit their data to government or organization. Like in India, it is ICMR. I'm sure all the countries it will be there, something or the other, parallel to that.